What scientific breakthrough have you seen have the most impact?
Well, I think the scientific breakthrough that has had the most impact, at least for my world, are the results that we've seen in gene therapy for single gene disorders, for well-chosen targets, the dramatic effects on the phenotype that you can see if you deliver a copy of the gene to the right target tissue. So if we look at the results from, for example, Zolgensma, Luxturna, if we look at the results in thalassemia, Zynteglo, if you can get that gene to the right target tissue, to the retina, to the spinal motor neurons, to hematopoietic stem cells, you really see a dramatic effect on phenotype. And what that means is that all of those products were approved on relatively small studies, dozens of patients, not hundreds, not thousands, the way that we see for some small molecule drugs. And so, I think that's a really very compelling result. If you can get the missing gene to the right target tissue, provided it's a well-chosen disease, you can have a very dramatic effect on the phenotype. And I think that that's a very, you would have predicted that, but it's reassuring to see that it's the case.
What new scientific discovery are you most excited about and why?
I think I would have two answers to that question. And they would be gene editing and the rise of non-viral gene delivery. So as long as I've been in the field, which is longer than I care to admit, people have been interested in developing non-viral gene delivery. And certainly that would solve many problems related to human immune responses to vectors that are engineered from naturally occurring viruses. But through most of the time that I've attended scientific meetings, the efficacy, the efficiency of non-viral gene delivery has been low. But at the most recent American Society of Gene and Cell Therapy meetings in May, I did see presentations involving non-viral gene delivery that is in non-human primates now, not in human subjects, but that give me hope that there will be meaningful opportunities to do gene delivery using non-viral gene delivery vehicles. And so I'm excited about that. And I'm excited about gene editing for all the reasons that everybody knows, not only for the very exciting results that have already been obtained in patients with sickle cell disease, but also for the much newer efforts of gene editing in vivo in the liver. And I think that that opens up, obviously, all sorts of possibilities and obviates the need for repeat administration in pediatric patients, for example, who might outgrow an AAV mediated gene delivery, but who will not outgrow a gene editing event. So, to me, those are the two most exciting recent events.
What's the most important unsolved scientific or medical problem?
From a gene delivery lens, I would say that to me, one of the most compelling areas that could really benefit from more work is the problem of global delivery to the central nervous system. So I think that we have been able to solve some specific problems around gene delivery to the central nervous system. I think we can do focal delivery, and I think that we will see benefits of that for diseases like Huntington's and Parkinson's. But I think that when it comes to doing global delivery to the CNS, not for a secreted gene product, because I think that the data from LibMelD suggests that for a secreted gene product, you can use a lentiviral vector into hematopoietic stem cells and count on the microglia to secrete your transgene product and get global delivery. But for a cell autonomous defect in the central nervous system, Can we solve that problem?